We're really excited to be developing this new research programme consortium, ReBUILD for Resilience, which is working on health systems in fragile and conflict-affected settings. And it's being led by Liverpool School of Tropical Medicine and Queen Margaret University in Edinburgh. And we're working with partners in Nepal, Sierra Leone, Myanmar and the Lebanon.
So our aim is to build on the very influential and important work that ReBUILD started. And to take it even further, particularly developing our networks of stakeholders and relationships that were developed through ReBUILD, but adding in new associates. We've got OPM and IRC who are going to help us do exciting, innovative work and extend our influence. But we are also looking at a wider range of settings this time. So ReBUILD focused very much on the post-conflict moment. But we now want to extend to a broader range of stressors. So we recognise countries are facing a lot of chronic and acute shocks, don't always have the tools to be able to manage them. And our aim is to assist in that process with our research, particularly focusing at the local health system, because that's where things really happen or don't happen. And developing, as I said, tools and guides that policymakers, communities will find useful in addressing the challenges that they face.
So let's hear from the different partners about this new exciting research consortium.
My name is Susil Baral. I work for HERD International in Nepal. The most important thing it excites to me in this ReBUILD for Resilience consortium, it starts with this very strong foundation of ReBUILD research, which has experience for a number of years with a number of studies, and that has impacted not only at the LMIC level, but also at the global level. I feel really passionate to work with the team led by very experienced, renowned, world-class researchers. And it provides opportunity to bring partners like us from low middle-income countries together to share experiences, to discuss about our context and appropriate model that helps building resilience in health system across the country as well as beyond. And this issue of resilience has been talked quite a lot, but this is time now we practice in our country with our country stakeholders. It helps country to move step forward in terms of enhancing health systems that is more resilient, that leaves no one behind, takes care of people who are in need, and successfully delivers its services despite the context that we are experiencing virtually on a daily basis in our context with lots of vulnerability in health systems. What does it mean to Nepal? It's very important that we are experiencing a lot of shocks and vulnerability that threats health system to deliver effectively. We recently had an earthquake in 2015, and we are learning how to make our health system much more resilient to be able to deliver expected services for the people. Evidence matters a lot, and we require more evidence which is contextually tailored, which can be used by the policymakers, policy players in our context, which can bring the community voices together. That's why this consortium, ReBUILD for Resilience, is very important for the country like Nepal and other low middle income countries. It connects the dot which is yet to be connected in health systems to make health system more resilient.
So I'm excited about the ReBUILD for Resilience Programme Consortium because it builds upon the efforts and the gains we have made during ReBUILD Phase 1 in Sierra Leone. So I strongly believe that ReBUILD Phase 1 contributed a lot into the policy-making space in Sierra Leone by engaging with the right policymakers, the right stakeholders to ensure that the findings then were incorporated and informed the development of policies and strategic plan at the national level. in support of the overall health systems rebuilding process in Sierra Leone. So I'm very excited that Rebuild for Resilience will build upon that and ensure that as researchers we can build on that momentum to ensure that evidence is being fed into the policy making space and we're supporting the research into action process.
What's really exciting for the Burnett Institute in Myanmar about this is the chance to work with stellar organisations from South Asia, from the Middle East, from West Africa, and world-class leaders in health systems research. What's also exciting is the chance to focus on this concept of resilience, how health systems suffering sudden shocks or chronic stresses can work out ways to respond that goes beyond just adapting or absorbing the stress, but actually works towards transformation. I think this is an area where research can really lead to some quite practical actions. And from Myanmar, the Burnett Institute actually works across Southeast Asia and into the Pacific. And it's really encouraging to us to see that the challenges that we face in this region are actually shared by other low and middle income countries. That's come out in the discussions for this consortium, and working out how to share learning from other similar settings is a real strength that the consortium offers. The consortium is actually a great fit with current health policy and health research discussions in Myanmar at the moment. And Myanmar is a country that's opening up politically, but the health system is challenged by many quite hard to reach areas that are suffering various forms of fragility, including the effects of sustained conflict or other environmental stressors. And so the system really needs new options for how to work on some of the critical issues such as involving non-state actors such as the ethnic health organisations or the private sector, how to cope with the intense decentralisation that has many subnational sections of the country interacting with the national government in quite different ways, how we can better maximise community health understanding and community engagement in the health sector to make it stronger. Many of the health system pillars in Myanmar need strengthening, such as better health information for surveillance or data for decision making, or medical supplies, procurement and distribution. And specifically, these are critically important for areas such as averting antimicrobial resistance. And so the chance through the ReBUILD for Resilience Consortium to work on some very practical policy relevant issues is very welcome in Myanmar. And some of the questions that are raised fit beautifully with the current National Health Plan and what it's looking for in terms of innovation in how it provides access to services in quite difficult areas of the country.
The most important and exciting issue about this project and consortium is this is a multi-country project, but more exciting is a multidisciplinary one. Approaching such a sort of a different and tough topic actually in a gender-based way, in a sort of being sensitive to culture, in a way that addressing the vulnerable population, including disabled. I think this is gives the project, the whole project, a sort of a strong position in addressing people's needs. In Lebanon actually is a country of a long-term conflict context, with a lot of instability, political instability, and hosting a big number of displaced population. Having said that, this project dealing with the issue of refugees, displacement, people in sort of different conditions, sharing experience with other contexts, with other countries, give myself as a researcher, but also the country itself and the health system an opportunity to improve sort of the quality of care, sort of the enhancement of people's needs or people's health needs, and addressing any specific displaced population and the host communities.
At the IRC, we do a lot of direct health service delivery in fragile and conflict-affected settings, mostly at the local level. We also engage in local health system strengthening at the district level, the province level, the community level, and the facility level. I'm really excited about this research project because it gives us an opportunity to learn more about what works and why it does work and in what context does it work. Because context is very important in all that we do, and this project, this research program actually gives us the opportunity to learn better what works in certain contexts.